Alarming surge in mental ill health among young people, a global call for action. The state of mental health among young people is reaching a crisis point. A groundbreaking report from the Lancet Psychiatry Commission on Youth Mental Health has revealed a dangerous global trend. Unprecedented challenges like climate anxiety, insecure employment, and unregulated social media are driving a surge in mental ill health among people aged 10 to 24. These issues are compounded by systemic neglect and underfunded mental health services, leaving millions without the care they desperately need. This article delves into the root causes, explores the devastating consequences, and outlines actionable steps for addressing this crisis. Tackling this issue requires a global effort from governments, organizations, communities, and individuals. The alarming reality of youth mental health, by the numbers. Mental health is a cornerstone of overall well-being, yet for young people, it is increasingly fragile. According to the report, mental ill health accounts for 45% of the disease burden in people aged 10 to 24, but only 2% of global health budgets are allocated to mental health care. Even in wealthy nations, less than half of mental health needs are being met. Professor Patrick McGorry, Executive Director of Australia's Origin Centre of Excellence in Youth Mental Health, has labelled this crisis as the most pressing public health issue of our time. He notes that if similar declines were observed in diseases like cancer or diabetes, governments would mobilize immediately. Yet mental health continues to face systemic neglect and stigma. Key drivers of the mental health crisis. 1. Insecure employment and economic inequality. Economic instability is a major stressor for young people today. The rise of low-wage, precarious jobs, coupled with the inaccessibility of affordable housing, has created a generation plagued by financial insecurity. In many countries, the median price of a home is several times the average annual salary, leaving young people unable to achieve the financial stability their parents enjoyed. Wage theft and underemployment add further pressure, eroding confidence in their future. 2. The climate crisis. Environmental issues are no longer abstract concerns for young people, they are immediate, tangible threats. The term eco-anxiety has emerged to describe the chronic stress caused by climate change. Global inaction on climate change is contributing to feelings of hopelessness among young people. They are growing up in a world where extreme weather events, rising sea levels, and biodiversity loss dominate headlines, leaving them uncertain about the planet's future. 3. Unregulated social media. The rapid rise of social media has transformed how young people interact, but it has also introduced significant mental health risks. Unregulated digital platforms are rife with harmful content, cyberbullying, and misinformation. Algorithms designed to maximize engagement often amplify polarizing and distressing material, leaving users vulnerable. A contributor to the report, identified as Lee, shared her harrowing experience of encountering unsolicited adult content online at the age of 12. I felt the internet was a place to escape, but instead, I was exposed to unregulated, harmful content, she explained. Social media has also been linked to poor body image, heightened anxiety, and feelings of inadequacy among youth. Platforms are failing to safeguard their users, prioritizing profits over mental health. 4. Cultural and social fragmentation. Economic policies that prioritize individualism and competition over community welfare have fractured social bonds. This societal shift, driven by neoliberalism, has left young people feeling isolated and unsupported. Professor McGorry highlights this disconnection, stating, "We are seeing a fragmentation of society where public welfare and social services are eroded, creating a generation devoid of security and hope." The global picture, high-income versus low-income nations. The mental health crisis transcends borders, but its manifestations vary widely. While most of the evidence comes from high-income countries, 90% of children and adolescents live in low- and middle-income countries, regions with the highest burden of mental ill health and the least resources to address it. In these countries, the level of unmet mental health needs can approach 100%, according to the World Health Organization, WHO. Limited access to healthcare, stigma surrounding mental illness, and a lack of trained professionals contribute to this crisis. Carla Drysdale, a WHO spokesperson, emphasizes that even resource-constrained nations can take steps to improve mental health care. Building community-based support systems, such as school counselors, peer networks, and non-specialist workers, can make a significant difference. The devastating consequences of inaction. 1. Rising suicide rates. Suicide is the leading cause of death among young people aged 15 to 44 in Australia, 15 to 19 in New Zealand, and 15 to 39 in India. The absence of early intervention often leads to tragic outcomes, robbing families and communities of young lives. 2. Loss of potential. Untreated mental illness results in lost opportunities in education, employment, and personal development. This creates a ripple effect, perpetuating cycles of poverty and limiting societal progress. 3. Economic strain. The economic cost of untreated mental health issues is staggering. Lost productivity, healthcare expenses, and social welfare burdens add up, making mental health not just a personal issue but a societal and economic one. Addressing the crisis, solutions and recommendations. 1. Reform policies for intergenerational equity. Governments must implement policies that promote fairness between generations. This includes investing in affordable housing initiatives, tackling wage theft and precarious employment, prioritizing youth-focused policies in climate action and public health. 2. Regulate social media platforms. Policymakers need to establish robust regulations to hold tech companies accountable for the content they host. Key steps include implementing content moderation standards, requiring transparency in algorithms, encouraging platforms to prioritize user well-being over profits. 3. Increase funding for mental health. To match the scale of the crisis, governments and organizations must significantly increase their investment in mental health services. Key areas for funding include training non-specialist workers to expand access, integrating mental health education into schools, establishing accessible community mental health centers. 4. Strengthen community support systems. Local networks, including schools, religious institutions, and NGOs, can play a pivotal role in supporting young people. Training peers and mentors to provide initial support can reduce stigma and bridge gaps in formal care. What young people can do to advocate for change. While the burden often falls on young people, they also hold the power to drive change. Here's how. Raise awareness, share stories, data, and resources to spark conversations about mental health. Join advocacy movements, support organizations fighting for mental health reform, climate justice, and fair employment practices. Seek help early, utilize available resources and encourage peers to do the same. A collective responsibility. The mental health crisis among young people is a global emergency that demands immediate action. Governments, corporations, and communities must work together to address systemic inequalities, regulate harmful industries, and expand access to mental health care. The well-being of future generations depends on our willingness to act decisively. The time to prioritize mental health is now.